Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined by pandemic expert, Dr. Carlos Del Rio, Professor of Medicine and Public Health at Emory. Dr. Del Rio, as always, it's good to see you.
It's good to be with you.
It's hard to figure out what is the most important stuff for us to begin our talk with today. We took last week off from our talks and things have changed since then. One of the questions that I got in advance of our talk today was asking, where are we with the numbers for COVID cases in Georgia? Can you talk about that to begin?
Well, I think what we can say is that the number of cases in Georgia is approaching 50,000 roughly, and the number of deaths is a little bit over 2,000. And I think what we know is that cases will continue to increase because we're doing more testing. So cases will continue to go up. So cases doesn't necessarily become the best indicator. I think we need to look at deaths, but we also need to look at hospitalizations. And hospitalizations throughout Metro Atlanta and throughout the region are flat to somewhat going down. So I would say that in this moment in the epidemic, we have ongoing transmission, we have persistent transmission, but we don't have, the virus is becoming more endemic than anything else. This is becoming something that is sort of among us and will continue to be with us. And what we want to avoid is not seeing spikes. I see that unfortunately we're not seeing, in the US in general and Georgia in particular, we're not seeing what we saw in Italy, for example, or even we're not seeing what we saw in New York, which is really the cases coming down significantly. We're not seeing that here.
Okay. Do you know of any resources or outreach for the many protesters Mayor Bottoms instructed to get tested after protesting? Can you talk about that in the context of what your thoughts are on seeing the protesting here and around the country and what the health impacts could be for these protesters?
Well, first of all, I think we need to say, we need to really think about why are people protesting and what is going on. And I think what we need to understand is that, racism and racial inequalities in this country have been going on for a long time. And I think that COVID is simply a reflection of that, right? When we look at the COVID epidemic, we're not seeing an unequal epidemic. We're seeing an epidemic that is disproportionately impacting African-American communities. So you have that one issue. Then you have the second issue, which is the economic downturn. While it impacts us all, it actually disproportionately also impacts African-American and minority Hispanic communities because they are more likely to be in jobs that have been laid off, that have been dismissed. So unemployment is higher in those communities. And then you add to that the what we saw in deaths of Black people, not only in New York and here in Georgia and Brunswick, but also most recently in Minnesota. And I think what you see is that it simply was those episodes of brutality that we saw on television is simply what ignited a fire, but the gasoline was already there. I mean, I think we need to really think about how do we address racism, how do we address inequalities, and how do we use the COVID epidemic as an opportunity to do that. So again, when I talk about COVID, I talk about going to a new normal. And when I think to a better normal, I think a better normal in which, as a matter of fact, we got to take into consideration addressing inequalities and addressing racism. Because if we don't do that, if we don't address the structural racism, we're not going to be over this epidemic. This epidemic is disproportionately impacting African-American communities. Now, what I would have liked to see is protesters use a mask and exercise the right to protest by using face masks in order to prevent the risk of transmission. Now, what the mayor said is go get tested. There are plenty of places to get tested. And I think you can get tested for free. Fulton County has many places. The state has many places. I was recently driving by, the old Fulton County Stadium, the Turner Field, and the parking lot there has a testing place. You just drive in or you just walk in and you don't need to make an appointment. You get tested. You can make an appointment through the web, and the state has a testing site in Georgia Tech that works very efficiently. So there are many places to get tested. And I think not only the protesters, but I think anybody should get tested. We really need to get people tested. That is really an important strategy at this stage in the epidemic, is increasing the number of people who've been tested.
Even people who have not been symptomatic at all and feel just fine?
Well, I think if you're not symptomatic at all and feel just fine, you probably don't need to get tested. But if you've been at work and somebody was diagnosed at work, or you've been, in your community and you're in your family and somebody was diagnosed, and you've been exposed, even if you don't have symptoms that you've been exposed, you probably should get tested.
Do you have a date in mind where you will look at the numbers, and if they are not going up like everyone expects, given the opening of the economy, that you would concede that maybe this virus is not as bad as we thought it was?
Well, let's start by the end. I think this virus is worse than we thought it was. I mean, let's think about a virus that has already killed 100,000 Americans in a short span of 3 months. I mean, I'm surprised people are not shocked by that. I mean, this is an unprecedented mortality as a result of this epidemic. I mean, people died at a rate of 3,000 per day. That is equivalent to one 9/11 on a daily basis. If people don't think that over 100 days is significant, I don't know what they think. I mean, this is the worst pandemic we've seen since 1918. The reality is we don't totally understand viral dynamics. And as long as the virus is around, you can have an uptake at any moment. So, I don't think there's a date. The date that I'll say this is over is when we have a vaccine, when we're able to prevent it. Until then, I think throughout the world, we need to be ready for potential, outbreaks. What we need to do is we need to have enough testing and enough, contact tracing capabilities. So when somebody gets diagnosed, you control the outbreak. You don't have a fire. And as I tell people, it's a little bit like the fire department. You want to be able to stop a fire before it burns the entire neighborhood.
Right. Should I get antibody testing, and are they accurate?
I think at this point in time, I don't think it's necessary for people to get antibody testing. I think antibody testing is a good way for public health to see where the epidemic has been. But the reality is maybe 5 to at most 10% of the population are going to be antibody positive. And there are many tests out there, and a lot of them are not very reliable. So it's not something that I would recommend people get without, no clear indication.
Is there a way to screen myself for COVID-19 at home?
Well, I do the home test for COVID-19, which is I wake up in the morning, I take my temperature, I think about my body, how am I doing? I don't have any aches, pains, I don't have malaise, I don't have fatigue. And then I go downstairs and smell the coffee. And if I can smell the coffee, that's pretty good. That's my home test for COVID-19. Because the reality is that anosmia, the loss of sense of smell, is one of the really interesting signs and symptoms in this disease. Almost 30% of people with COVID, especially early on, present sudden loss of a sense of smell and or taste. So, smell your coffee in the morning. I think it's a pretty good test. That's as good a home test as you're ever going to have.
And one that'll actually make you happy. Should I wear a mask at work if I'm not clinical? The grocery store, the park. Looks like we need to go over the mask stuff again, Dr. Del Rio.
Yeah, there's a lot of confusion and among people about masks. And I would say that in the British journal, The Lancet, yesterday or 2 days ago, they published an article. It was a very good article looking at all the different impacts that masks have and the way that masks prevent transmission. And they looked at several things. They looked at social distancing. They looked at masks. They looked at face shields. And there's several things. Social distancing works and decreases transmission from about 12.5% if you get exposed to somebody to about 2%. Masks do the same thing. They decrease transmission again. If you're not wearing a mask, from about 12.5 to about 3 or 4%, and face shields from about 12.5 to about 1 to 2%. So why do we wear a mask in public settings when we're with other people? Well, we wear it not to protect ourselves, but actually to protect others. If I happen to be infected and I'm wearing a mask, the chance of me passing the virus to others decreases significantly. And if everybody's wearing a mask, then we're all protected. The problem is if you have some people wearing it and some people don't. So we need everybody to wear a mask. The face shields are a little different. Face shields actually will protect you. And there's several colleagues in Iowa that are big fans of face shields and that think that we ought to be in the community using face shields. I don't think we need to use face shields to go to the grocery store, but I would say that if I was getting on a plane today, I would certainly use a mask and a face shield if I was getting on a plane today.
Interesting. Should I go to my regular screening appointments like a colonoscopy or a mammography? A lot of people have asked me about this. What about scheduled dentist or eye doctor appointments? Just regular things we put on the calendar every year.
Well, I think that's a really important point. I think that a lot of us have postponed sort of maintenance checkups, maintenance care, and that has actually had significant impact. For example, in children, in which we see immunization schedules not being kept and kids not staying up with their vaccinations. I think you need to talk to your provider. I think most places are opening up now. I think most places are up and running again. I would say that, I guess last week I went to a dental appointment, and it wasn't a scheduled appointment. It had something that I had to do, but my dentist had just opened that week. And I was very impressed about the kind of precautions they were taking, the kind of way they managed things. So I was not very concerned at all about the possibility of getting infected going to the dentist. My advice is, yes, it's time to go back and talk to your provider and go back and schedule your appointments that you need.
This question may be redundant, but if I was scheduled for surgery prior to COVID-19, should I now reschedule the elective procedure?
Again, the same thing. A lot of elective procedures are opening back up again. I think you need to talk to your doctor. I think you need to talk to the hospital. But the reality is, if it's a necessary procedure, I will go ahead and schedule it and get it done. There are some precautions hospitals are still taking. You're very likely going to be asked to get screened for COVID before you have the surgery. And that's important to prevent, anesthesiologists and other people from getting infected. But they are doing that routinely. And, we're testing almost all patients where they get admitted or preoperatively for COVID. And it's a good way to diagnose people. And also it's a good way to prevent transmission in the hospital. We need to not forget that this virus has significant, what we call nosocomial spread. In other words, they're spread within the hospital, and healthcare workers are at very high risk of infection.
Is it safe to go to the ER if I'm having chest pains? What about the urgent care if I have a twisted ankle?
Well, if you're having chest pains, you need to go to the ER, and it's more unsafe to stay home. And in fact, we know of multiple people who have died at home because they did not go to the ER. So yes, if you're having chest pain, if you're having signs of a stroke, if you're having anything that suggests you need urgent medical care, you need to go ahead and go to your medical care, because the chances of having a complication and even death as a result of not going to the emergency room are worse than the remote possibility at this point in time that something will happen because you go to the ER.
Can I swim in the pool? Does the virus spread in a pool?
Well, you can swim in a pool, it's totally fine. But you shouldn't be, for example, in a pool, playing water polo with others or jumping around with a bunch of people, because the virus is going to spread from somebody else. It's not going to spread. It's not going to be in the water. It's going to be when somebody else is in the water with you, and that person may be, swimming or breathing hard in front of you. I mean, I can think about two people in the pool, playing water polo, and each one sort of breathing on top of each other. That's when the transmission would occur.
How can I make sure my child is safe at daycare or school in the fall?
Well, I think that a lot of schools are looking at ways to make it as safe as possible. And I would say that, again, social distancing in kids is very hard. I think it's going to be complicated to see what schools are going to implement. But the reality is that a lot of things are being tried in order to prevent transmission in schools. I think what I would say is get involved. Go to your school, get involved. Read the CDC guidance. There's guidance that the CDC has put out on what schools need to do. Get involved with the school, make sure those guidance are implemented.
Another school question. A private school in Atlanta had an outbreak after parties and get-togethers were held. Does this show us what will happen when we put kids together at school?
Probably. Yes, that's going to show us what is going to happen. But again, if people get infected, but nobody ends up, and from that outbreak, I don't think anybody ended up in the hospital and nobody has died. If we just see outbreaks like that, I think that's what's going to be the reality. We're going to be seeing outbreaks like that, and we need to stop them. We need to control them. We need to prevent them, but they're going to happen. And I think at the end of the day, we need to understand that this is going to be part of the reality of the new life.
Speaking of that, someone just asked, is it true that COVID in the future will be like the flu for us today?
It may be. I think it's a possibility. I can't predict the future. Otherwise, I would be in Vegas right now. But I suspect that it may be. It's very likely that this virus will become part of the respiratory viruses that live with us.
A bit of an open-ended question here. What should we do now, considering where we are in the opening up process and crowds gathering this past week?
Not necessarily understand. What should we do? Well,
yeah, I guess it's just probably behaviors out.
Well, what I would tell people, and I say this over and over, is not what should we do, is what do I do? And I think what you need to do is decrease your chance of you getting infected, which means you need to practice social distancing. You need to wear your mask. You need to wash your hands. I think it's what we do that prevents infection. There's a very good website that I saw from a colleague of University of Pennsylvania that looks across the country and looks about the impact of policies of political decision versus individual decisions in number of cases and deaths we will see. And the bigger driver is individual decision, not policy decisions. I mean, a politician can say, yes, everything is open, but if people don't, continue practicing social distancing and wear a mask and do the things they need to do, you're not going to see infections. So I think the reality is, what can I do to prevent from getting infected myself?
To your way of thinking, what is the most important, significant thing we've learned about this virus?
Oh, we learn a lot of things, and we learn about how it's transmitted, how it's causing disease. We're learning a lot of things. I think the most significant thing we've learned is that this is a really tricky virus. Transmits very efficiently. I think it transmits very well in close quarters. I think it transmits mostly person to person, and I think it's highly contagious in close environments.
This next question I've gotten from several people, so I'm just using one question to cover this. What are your thoughts on returning to the office? What key steps would you be looking for to determine if and when it would be safe for us to do? I have a lot of friends who've personally asked me to ask you about this.
I mean, it depends what's your office like, right? Depends what you do in your office. I mean, I think that I would go to the office, practicing social distancing, and wearing a face mask when I'm going to be around a lot of people. And I think office parties probably shouldn't have happened for now. And I think we need to decrease the number of meetings that we have. And I think if there's one good thing about this is, I think a lot of unnecessary meetings we had are probably going to go away. And I think we need to think about maybe how do you stagger people in such a way that some people can come to work. I think we need to look at offices of who can continue teleworking and who needs to stay home. So there's different approaches that we need to take to addressing this epidemic.
Here's a question we haven't gotten before. If you were hypothetically given $100 billion to allocate, how would you allocate that money to best respond to COVID-19 in the global health sphere?
I mean, I think that there are a couple things that are important. Number one is really scaling up testing. We need to have much more testing. In the US, we're doing better, but I think globally we're still way behind. Number two, we really need to develop a contact tracing force that can really rapidly respond. And then number three, I think you need to spend a lot of money still in personal protective equipment, because there are many healthcare workers across the world that are dying because they don't have personal protective equipment. And, I was reading an article in New York Times about what's happening to physicians in Russia, for example, in which many are getting infected and dying. Protecting the healthcare workforce that in many developing countries is very limited, I think is a key component. If this virus were to get to Africa and the few people working in hospitals in Africa were to die, we would be in a serious problem. So I think protecting healthcare workers is going to be critically important.
How confident are we at this point whether or not this virus is seasonal?
Well, we've only had one season, maybe, starting winter, maybe spring. So I don't know. I mean, we're not confident at all. I mean, again, predicting the future is very hard.
How significantly will these mass protests nationwide likely spread COVID-19?
I don't know. It depends how many people with COVID-19 went to the protests, right? And I want to be sure that we don't use the protests as a way to, if we see a spike in protests, we don't blame the protesters for seeing the spike. I think we need to be careful and see, the biggest concern that I have with the protesters is that they get infected and then they take that infection back to their homes and they infect people in their communities. To me, that's my biggest concern.
My question is, if the virus is not going away and there may never be a cure, how can not going back to school, college, even be part of the conversation? We continue to hear this might just be something we learn to live with. Do the numbers really support more months of lockdown, soft or hard lockdowns?
I think we're learning to live with it because we can't stay in lockdown the rest of our life, right? And I think going to school, I think going to work, I think everybody's looking at ways to create a sort of a new reality that we all need to live in, because the reality is we can't stay in our homes forever. But I think again, this is going to be transitory. There will be, in the big spectrum of things, probably by next year or sometime next year, we'll have a vaccine. We'll be in a very different place than we are today.
I see some playgrounds are opening. Should I let my children go? Do they need to wear masks?
I think if they're going to be with other children, it's probably a good idea that they wear a mask. If they're going to be in the playground by themselves, I think there's no reason. I think they can go, they can play in the playground, and then you should probably, be sure they wash their hands before they finish, and that's it.
Dr. Del Rio, I get this question multiple times a week, so I'm going to ask you again because I've already gotten it multiple times since we started talking. Will Emory have the undergraduates back on campus this fall?
I think that's a decision that at the end of the day is going to be the Board of Trustees, the president, the president's cabinet that is going to make the decision. I think that there's a lot of interest on having undergrads return to campus, and in some sort of way, whether it's going to be a full or part, I think we don't know yet. But the goal is to go towards that.
What is more of a threat, the virus or the inflammation it seems to trigger?
Well, the inflammation is because of the virus. So obviously, if you don't get the virus, you're not going to get the inflammation. So it's a little bit like, it's a bullet and then you have a bleeding. So, if you didn't have the virus, you're not going to get the inflammation.
I know this is conditional on a safe, effective vaccine, but in 5 to 10 years, do you foresee COVID-19 becoming a virus like measles, less than 1 million cases a year with occasional outbreaks in high-income countries, or more like influenza, where there are tens of millions of cases a year? I think what I would also add to this question is COVID-19 going to be something that for the rest of our lives we live with like influenza?
I think it's likely going to be like influenza. I think it's going to become another respiratory virus that it's around. But of course, depending on what kind of immunity we have to the virus, I think a big difference between this virus and influenza, it may be that once you get this virus, you become immune and you don't get it again. Once you've been vaccinated, you don't get it again. And if that's the case, over time, the virus will disappear, right? It will go away because simply viruses need new people to infect. If there's no new people to infect, they can't continue persisting.
With delays in reporting and possible misinformation, what is the most reliable source to use for following the curve?
Well, I think depends where you're looking at. I think still, I would say that the Georgia DPH site is looking better. They're doing a good job trying to make it more useful. It had more information on it. I think there's multiple other sites. There's a site called, COVID exit strategy that is very good. There's another site looking at COVID information from Hopkins that is very good. CDC has some good information. I think there's a lot of places to look at data.
How should healthcare professionals handle patients who have recovered from COVID-19 weeks after their illness? How long after they're asymptomatic can healthcare professionals be confident they're no longer contagious? For example, considering them for elective surgeries.
I think we're very confident right now that 10 days after your infection, you're no longer infectious. So, you clearly are out of the woods after 10 days. You're no longer infectious. You may still test positive, but you're no longer infectious.
Can we play pickleball or tennis?
I think tennis is fine. I think tennis is actually a social distance sport.
I'm not sure about this question. I'm going to read it to you. It says, I'm confused. Will asymptomatic people have a temperature? If not, why are we doing this? I'm not sure about the second half of the question.
No, the second half, the people are no. So that's a really good question. I think that asymptomatic people, by definition, are asymptomatic. They don't have symptoms. So if they had a fever, then they're not asymptomatic. They have a fever. And I think the question is, of people that present with COVID, only about maybe 30 to 50% initial presentation have a fever. So the question that this person is asking, why are we screening for temperature at grocery stores or at restaurants or at work environments, or when I come to the hospital, they're screening for temperature. I think temperature screening is we're increasingly realizing is not very useful, but it's something that we're continuing to do because it's something that, again, it provides another potential point of deterrent. Well, I may say, well, if I go to work and they're going to check for temperature and I have fever, they're going to turn me around. So maybe I just stay home.
Yeah. Can you comment on what has been shared so far about remdesivir and other antivirals being studied?
So remdesivir is the antiviral that has been studied the most. It is an antiviral that was initially developed by the company, pharmaceutical company Gilead Sciences. It was developed to treat Ebola. It did not work against Ebola. It was then, with this virus, it was tried against SARS and MERS in cell culture. It had some activity, so therefore people thought about trying it against this virus. There has been now several studies published that either show a very little benefit to some benefit. I think the best probably is a study called ACT-1 that used remdesivir and showed that people with moderate to severe COVID, if giving remdesivir, they were less likely to remain in the hospital. They decreased the number of days that they require support in the hospital, specifically oxygen, from about 15 to 11 days. And it also decreased the overall mortality from about 11% to about 8%. That second finding was not statistically significant, but it was trending towards there. So based on those findings, remdesivir was approved by the FDA was giving what is called a emergency use authorization to be given to people with moderate to severe COVID. It's an IV medication, so it's not something you can use in the outpatient setting. It's something that we're reserving for people that have fairly severe disease. At this point in time, we really don't have hospitalized patients. At this point in time, we really don't have treatments for people in the outpatient setting. And that's where a lot of the research is happening right now. What kinds of things do we need? And in that sense, we're looking at various antivirals. We're also looking at monoclonal antibodies, and we're also looking at other medications.
How much false positives do you see on nasal swab test? My son tested positive, but none of the close contacts, 20 plus, tested positive or have any symptoms.
I mean, again, your son is not a false positive. It's a true positive, tested positive. That doesn't mean that the others needed to test positive. Your son is a true positive. It tested positive. That's not a false positive.
In the coming years, how can the global health community best pivot on COVID-19 to respond to other public health issues in addition to COVID-19, such as the global burden of chronic disease, HIV, TB, etc.? Should we use it as a catalyst to augment and advocate for universal health care in low and middle income countries, or some other useful strategy?
I think a lot of those are good questions. I think a lot of those are things that are going to be looked at. I think what we need is probably a different governance in global health. I probably think a different way of addressing global health. And I think a lot of that is going to happen as a result of COVID. I think COVID is a good opportunity to relook at global health and see what can we do better. And more importantly, what can we do to prevent another outbreak like this from happening again?
I'm an optometrist. Do you think the air puff machine, non-contact tonometer, which checks eye pressures for glaucoma, is a safe machine for the patient and the technician? Or would the virus be aerosolized and be a risk for COVID infection?
You know, the way the machine is utilized, I don't think there's a risk. I mean, you're going to clean the machine when you put it in the eye. And the question is going to be, are you, the optometrist, and your patient going to be using a mask? I think if both of you are using a mask, you'll probably be okay.
What are your thoughts on hydroxychloroquine?
I mean, hydroxychloroquine has had, so far, we really haven't seen much of a positive signal. We've seen some of concerning signal, but mostly in hospitalized patients. I think that it's a drug that we need to study better. It's a drug that we need to understand better. I think it may have value in people in the outpatient setting. Again, I said that there was really no medications useful in the outpatient setting, but we really need well-conducted studies to know that.
Dr. Del Rio, the last thing I'd love to be able to talk to you about before we let you go are your thoughts as we head into summer. I had a friend tell me that his son, baseball has resumed, and they had a game, and he said it looked like COVID had never happened, that there were no masks and life was as it usually was. Other people have seen a lot of posts on Facebook, and I've seen some people posting that since the protests started, there's no mention of COVID, possibly, suggesting that maybe it wasn't that big a deal now that there's another story to replace it. And you also have people saying it's summer, it's sunny, it's warm, I want to be outside. So as we are in June now and going into the bulk of summer, our kids who were homeschooling are finished with it. Give us your thoughts on this and your advice.
I mean, I think summer is probably going to be a better time for COVID because we're spending more time outside, and we know that there's less transmission outside than inside. But it's not the solution. We know plenty of places where there's a lot of warm weather, like, for example, in Ecuador, in Guayaquil, where they had a major outbreak. So I think it's not like in the summer it's going to disappear. I do think we continue to be vigilant. I think we need to remind ourselves that this virus is still around. I think the summer is going to be difficult. I think, some of the travel plans, some of the things that we all wanted to do this summer may not be happening this summer. But we need to think about what things can we do and we can safely do in order to keep up a good spirit. I think it's going to be really important that we provide some time for our families and for our kids to really have some free time, and whether it's going to be going to the beach and maybe finding a way to go to the beach and not be surrounded by thousands of people and be able to enjoy maybe being in the swimming pool and being outside and taking walks and being on a bicycle. I think that nothing is 100% safe, but I think there's a lot of things that are a lot safer than others, and I think we need to look at it that way. We know one of the things you said, what do we know about COVID? Well, we know that transmission likely doesn't happen through casual contact. You need fairly extensive contact. So just because I walk by somebody or somebody drive by in their bike, that doesn't mean I'm going to get infected right away. It's highly unusual that that's going to be the case. So I think we also need to realize that, while we need to be careful, we also need not to be, paranoid to the point of being paralyzed. Because I think if we become paralyzed by this epidemic, I think we're losing.
I think you're right. Thank you, as always, for your counsel and your advice and for taking everyone's questions. We appreciate it, and we'll see you again next week.
Sounds good. It's good to be with you.
Good to be with you. Take care.
Bye.
All right, everyone. Thanks for joining us. We'll see you next week.